public service, and I don't want to put any words in your mouth. So, I mean, the question I'd like you to answer is, what has been the biggest mistake so far in your view? But if you'd rather answer, what is the question that most urgently needs to be answered, that would also be fine.
Well, I think I'm happy to start with the first, which I think the biggest mistake, and I think those in the government would agree with it, was abandoning containment on the 12th of March and stopping testing in the community. The countries that have pursued their testing and tracing throughout their outbreaks and tried to build up their capacity alongside have done much better. Think of Germany, South Korea, Taiwan, Norway, Denmark. So yeah.
And of course, then we move immediately, don't we, into almost a summation of the whole sorry mess, because we were told they were following the science, and as things have sort of frayed and fallen apart subsequently since that day in March, it would appear that decision was taken simply because we didn't have the kit. Does that tally with your understanding?
Well, I guess I would challenge that because, I mean, the UK is one of the richest countries in the world. And if we look at the countries that have built the capacity, these are not, these are countries like Senegal, Vietnam, Rwanda. So I think the big lesson that gets, if you look across countries, is it's about political will and a clear strategy from the start to say, this is what we're doing, steam right ahead with it. In a sense, you have to move before you know if you're actually right and trying to, in a sense, like before you have exact evidence. But if you're consumed with the evidence and you're winding yourself in circles about it, then the outbreak moves on, the virus spreads, and you get yourself in a worse and worse position.
Okay, so why do you think it happened then? Do you just think, because from what you've just said, it was almost as if they were like headless chickens?
Well, I think actually at the start, if I have to look back, it was treated by the scientific community who were advising the government like flu, kind of this was a virus that'll pass through. And this virus is the reason it's so dangerous. If it was clearly like MERS or SARS and it killed a lot of people, then you'd say, we have to contain it, throw everything at it. But I think because we have the sense of, 80% might be okay, it becomes quite dangerous to say, we should just let it go through, which is what Sweden and Netherlands are attempting. So I think it was this mixed messaging from the start and maybe mixed strategy of, should we let it go through and keep the economy running, kind of like what Sweden
this is what gets filed generally under herd immunity, slightly misleadingly, but the idea is that we build up immunity by catching it and recovering, and there will be casualties, but that's the price you pay for herd immunity.
Yeah, I mean, to try herd immunity without a vaccine and without a treatment means a lot of people will die, and largely elderly people and those who are vulnerable. And I think that's a moral choice that governments need to make. That's not a scientific choice. That's a moral choice. Yes. I think it's personally very wrong. But I guess in government, it'd be great if there was at least honesty. I think the Swedish government has at least been straightforward with their public, saying this is what we're going to try and this is what we're doing. And at least you can have an open public discussion then about that.
Yes, I mean, that is a contrast, isn't it? And I think Sweden is now approaching the highest per capita death rate in the world, but the Swedish population feel that they at least knew what was happening and why. Could that be in a more stark contrast to what's happening here in the UK? I mean, you must sit there as the chair of global public health at the University of Edinburgh, and I know, I hope this doesn't embarrass you, I know that in 2018 at the Hay Festival, I was there, but I wasn't at your talk, that you literally described, it's on tape. You literally described what would happen in the event of somebody in China contracting a virus from eating the wrong food and it then becoming a global pandemic. So there must be moments where you've wondered whether you've woken up in the middle of it or you are currently in the middle of an anxiety dream.
Yeah, no, definitely. And in a sense, I've been having nightmares since January as it's been unfolding, watching it first in China, and then it's almost been like in slow motion, seeing it roll out to the world. I think what was predictable was that there would be a pandemic. I think what was unpredictable is that the two countries that would struggle would be the UK and the United States.
Yeah. The reason is in the US you have Donald Trump, and in Britain you have Boris Johnson. Two leaders who are not interested in following the science, but in manipulating the science. Or in Donald Trump's case, when he doesn't like the science, he fires the scientists. Now, in the case of the UK, you have two mentalities driving public policy. The first being the Brexit mentality, the idea that we can do it on our own. We don't need to follow the advice of other countries. The other countries have their way, we have our way. We used to be an empire, for God's sake. So we don't need to rely on other countries. We are self-sufficient. We will succeed on our own. And unfortunately, that paints you into a corner where you are unable after to ask for help and reach out to nations that could actually support you and help you save lives. But the political mentality of Brexit denies reality and forces individuals, politicians in this case, to take bad decisions. And these bad decisions impact the NHS and ultimately cost lives. Of course, the other mentality is the Tory mentality, opaqueness and lack of transparency. The idea that the public don't need to know. The public are idiots and we just spoon feed them a filtered version of reality. Now, this lack of transparency and attempt to defend the party at all costs results in sending out mixed messages to the public, such as stay at home, no, stay alert, don't go to work, no, wait a minute, do go to work. Only go to work if you're an essential worker, but we will never define who truly are essential workers. So this idea, once again, of defending the party causes confusion because they're not willing to be transparent with the public, creating confusion, and then this, of course, facilitates the spread of the virus because people are confused, they're not understanding what the rules are. And then, of course, you have the icing on the cake here, where you have Dominic Cummings breaking the rules and not getting punished for it. So you're once again sending out a message to the public that they must respect the rules. But if you're a politician or a chief advisor to the Prime Minister, you are exempt. Now, another worrying aspect of the UK response to this crisis is the attempt to use the private sector to handle the pandemic. So you have private companies doing testing, private companies handling the contact tracing, and private companies sourcing PPE. Now, of course, private companies doing this is not an issue in itself, but because of the lack of transparency within the government and the fact that many companies have been given these contracts without a proper tendering process, I truly hope that we can learn something very important from this pandemic. The idea that we should listen to experts and we should invest in public services instead of gutting these public services over a decade and more and ignoring the experts because people have heard enough from experts and would prefer to listen to politicians for a change. Let me know in the comments, guys, what you think. As always, your comments are greatly appreciated. Thanks. Why not become a Patreon and enjoy access to our Discord server where we share news, chat, and have some fun? If you become a patron, you can also make video suggestions on topics that are important to you. Check it out via the link in the description.